I'm Louis Appleby. I'm Professor of Psychiatry at the University of Manchester, and I direct the National Confidential Inquiry which investigates suicide under mental health care. I don't think it's ever possible to say that we won't have suicides. So in that sense, I don't think we should take the zero of zero suicide too literally. What I think it does is set that ambition of working hard to prevent every death, that no death is inevitable, that we'll do our best for everybody. Well, the most recent figures show about 4,500 suicides per year in England, about 5,500 if we take the UK as a whole. But the important thing is that these figures have started to come down. After a period of a few years where suicide rates were rising, we've probably now got a fairly sustained downward trend. What's really important about the Zero Suicide Initiative is its sense of ambition. I think there was a time when, perhaps particularly in mental health services, where quite a lot of people are at risk, there was a sense that suicide is sometimes inevitable, that despite our best efforts, there isn't much we can do for some people. I like the fact that Zero Suicide is saying that it is a widely shared responsibility. That it's not just mental health, although that's obviously very important, not just public health, though that's crucial, but it's a number of agencies: primary care, the justice system, social care, the third sector, employers, the press. It's a widely shared responsibility, and that sense that society is tackling the problem of suicide, that is a very important message. I think in this country we have the best evidence on suicide prevention in the world. And it's a feature of the NHS. It's a feature of being able to work in a system like the NHS. And I think we now know what it is about mental health services that can reduce patient suicide. Safer wards, early follow-up on discharge, helping people who have problems of alcohol or drugs, safe prescribing, working with families. All of these things we now know can make a difference. I think it's crucial that Zero Suicide uses the evidence from this country. I think it is evidence taken from NHS practice. It's relevant to the lives of people, vulnerable people in this country. It's vitally important that we use the evidence on our own doorstep.